Good afternoon, friends. You're listening to EBC Radio 1170 AM Aapki Choice. And I'm your host, Alka. And as you know, whenever Alka comes on the radio, we bring you very special segment and very, very important and renowned speakers on EBC Radio. So today, this is our show called Cancer Education Series, brought to you by Robert Wood Johnson Barnabas Health and Cancer Institute of New Jersey. And today our guest is Dr. Miral Grandhi. She is a surgical oncologist and she is from Rutgers Cancer Institute of New Jersey. Dr. Miral Grandhi, MD, is a surgical oncologist in the liver cancer and bile duct cancer program, director of the Hepatobiliary Oncology Program at Rutgers Cancer Institute of New Jersey, and Associate Professor of Surgery in the section of Gastrointestinal Surgical Oncology at Rutgers Robert Wood Johnson Medical School. Dr. Grandhi completed her Complex General Surgical Oncology Fellowship at Johns Hopkins Hospital, where she received specialized training in pancreatic, hepatobiliary and gastric tumors, as well as minimally invasive approaches to these complex surgical procedures. Her primary expertise lies in gastrointestinal surgical oncology with a particular focus in liver and pancreas tumors, and she is board certified and trained in the latest surgical techniques to these upper gastrointestinal malignancies, including both advanced laparoscopic and robotic techniques. Wow, doctor, what a great work you have done and how much you have achieved in these years. We are such a privilege and honor to have you on EBC Radio. A very warm welcome on EBC Radio, Dr. Miral Grandhi. Welcome. How are you doing?
Very well. Thank you, Alka, for that warm welcome, and it's my privilege to be here. So thank you so much for the honor.
Yes, doctor, and it is our honor as well as our listeners' honor that they're going to be getting education from you on the gastrointestinal surgical oncology, where people would learn a lot from you. So what are the types of gastrointestinal cancers and who's at risk?
So that's a very good question, Alka. In terms of what types of gastrointestinal cancers there are, it can actually occur anywhere along the GI tract. So all the way from your mouth all the way down to your bottom. Basically the esophagus, the stomach, the small intestine, the large intestine, the appendix, the pancreas, the liver, the bile ducts, the gallbladder, even the lining of the abdominal cavity. In terms of who's at risk, there are various risk factors for each of these types of malignancies. So there's certain patients who are at risk for instance, colon cancer or stomach cancer based on their familial or genetic mutations. Mm-hmm. So things that run along families. Smoking can put you at risk of various cancers such as pancreas cancer. Chronic pancreatitis can put you at risk for pancreas cancer. Hepatitis B or hepatitis C infections as well as diabetes can put you at risk for liver cancer. So it's really specific as to which cancer you're talking to as in terms of who's at risk for those malignancies.
Wow. So gastrointestinal cancer kind of covers the whole entire inside of your stomach area, I guess, right?
Exactly. Your entire abdominal cavity. Precisely.
Right. So how do gastrointestinal cancers impact the South Asian community specifically?
It's a very good question. So they impact South Asian communities really in the same ways that they affect other communities. You know, it's very important to undergo screening. So colonoscopy, the screening has changed from age of 50 down to the age of 45. So once you hit 45, all patients should get screened at the age of 45 with a colonoscopy. If patients are having symptoms, so that's the biggest thing to do is not ignore symptoms. So if something doesn't feel right, definitely go to your physician. So it's important to undergo just standard screening guidelines. In addition, for South Asian community in particular, we are actually at a higher risk. I say we because I'm also South Asian, but we're at a higher risk of developing gallbladder cancer or biliary malignancies. And part of this is due to chronic gallstones, part of it's due to diet, and if for folks living in South Asia, parasitic infections or liver flukes can put you at higher risk of those malignancies as well. The other thing we're at a higher risk of is hepatocellular carcinoma or liver cancer because of things like diabetes or hepatitis B, hepatitis C infections. So it's just really important to, again, get continuity care with your primary care physician and undergo the standard screenings.
Okay, so like annual physical checkup is very, very important. That is
exactly
how one can really diagnose or go for the regular, extra checkups and all based on their family histories.
Exactly. And then for those patients who have a history of hepatitis B or hepatitis C infection, they should be seen at least once to twice a year by their gastroenterologist to undergo specific screening of the liver for that.
Okay. So friends, you're listening to Dr. Miral Grandhi. She is a gastrointestinal surgical oncology and she's from Cancer Institute of New Jersey. So she's giving us such a great information and I hope your radios are on and you have sitting and focusing on the content what she's talking. So health is wealth. So we all have to keep ourselves healthy. So doctor, what is the standard approach to treating gastrointestinal cancers and what types of surgical offer for GI cancer patients?
So again, that's really specific on the type of cancer you're talking about. Some types of cancer, such as colon cancer, may merely require just removing a portion of the colon. Other cancers, such as pancreas cancer, require getting chemotherapy either before or after the surgery. And the type of surgery is really based on the type of GI cancer. So it's very specific to each cancer. I would say, we are fortunate enough that in our group, we have 6 different surgical oncologists. There are at least 3 of us treating each disease site. So we're very fortunate that we have more than just one person treating each disease site. So in terms of the type of surgery that patients need, that's really dependent on the type of GI malignancy they need. But anything from removing potentially up to 80% of the liver can be done down to removing a small little portion of the small intestine.
Okay. So now, doctor, for patients who need gastrointestinal surgery, so what are the benefits of minimally invasive approach?
So a minimally invasive approach such as robotic surgery or laparoscopic surgery you may hear your surgeon talking about can be quite beneficial for the patient in terms of decreasing the time to getting back to their normal function. What we find is, particularly, for instance, colon cancer or stomach cancer, those operations can be done with a large incision going down the middle, but when those operations are done through a minimally invasive approach, you're using long instruments or using a robot where our arms are actually doing the work, but the robot is inside the patient's body physically doing the work, but are controlled by us on the outside. Those small incisions decrease the pain for the patient, increases the time, decreases the time to recovery, and actually we find it helps decrease the time to return of bowel function. So the patient's getting back to their normal function and getting back to their normal daily activity and such at a quicker time than if they undergo a larger operation. Now, for some of these operations, they're such big operations that a minimally invasive approach is not in their best interest. So when it's available and it's a reasonable approach, we do try to offer that to patients.
So now, what is the benefit of receiving this type of care at a National Cancer Institute designated comprehensive cancer center like Rutgers Cancer Institute, which collaborates with experts across the state in collaboration with Robert Wood Johnson Barnabas Health?
So that's a great question, Olga, and really what allows us to stand out in the state of New Jersey as opposed to other facilities is that, again, we're a NCI designated comprehensive cancer center. And what that means is we think about everything in a multidisciplinary fashion. And so when we discuss someone with a liver tumor, for instance, this morning we had liver tumor board, it's a combination of everyone who treats those liver tumors, from the surgical oncologist to the medical oncologist to the radiation oncologist to the interventional radiologist to the gastroenterologist, the whole gamut of people treating that disease process. So not only is the patient getting the opinion of one surgeon or one medical oncologist, they're actually getting the opinion of almost 30 physicians. So that's really what makes us a comprehensive cancer center. But in addition to that, it's the clinical trials we have to offer. It's the research we're doing in the laboratories here. And it's all of those key components that really allow us to offer the most up-and-coming technologies, most up-and-coming clinical trials, and really the latest technology to patients.
And to be NCI designated is a huge thing, right? And Rutgers Cancer Institute is part of that.
Yes, definitely. And so it's one of, I believe it's roughly 40 or 50 institutions across the country.
Wow. That's really great, and it's right around the corner. And if you all have any kind of difficulties, you're suffering and you have to see the doctors or get some opinions, so please visit to Cancer Institute of New Jersey, and they will give you all the information. And for clinical trials at Rutgers Cancer Institute of New Jersey in partnership with Robert Wood Johnson Barnabas Health, visit rwjbh.org/beatcancer. So with that, you will get whatever questions you have. You may find the answers, or you may have some phone numbers or emails which will guide you through to reach out to the right person. So, Doctor, any last words you have for our listeners so that, they can, follow those rules so that they don't fall into these kind of problems?
Yeah, so, not only, just to add to everything that you said, Alka, we treat not only cancers, but also as a liver and pancreas and bile duct center, esophageal center, a peritoneal surface malignancy center. We treat other non-malignant lesions as well that involve those organs that potentially require a complex operation. But most importantly, the kind of drive home message is get your care with your primary care. Go see your primary care every year. Do your screening like you're supposed to do. And anytime something doesn't feel right, don't wait and, go and see your primary care physician and get it worked up before something that could be potentially treatable turns into something that's not treatable.
Mm-hmm. And often people get fear, like if something unfortunately happens in the family, they feel like any little symptom also comes and you feel like you get scared that, okay, maybe I'm the next, right? So how can they get over with that fear?
Well, I think the key is, is getting more information, right? And seeing your primary care physician. And it may be that your primary care physician says this is nothing to worry about. Mm-hmm. And I think it's really just seeking the medical care instead of living with the fear. Because part of the problem there is that you may go for 6 months with that fear when a simple visit to your doctor can alleviate all your fears. Right.
Just one visit can really help a lot than just keeping it throughout in your mind.
Exactly.
Yeah. All right. So, doctor, physical checkups are very, very important, and everyone should visit. Do not get lazy there. Do not think you're too young to see everything is happening good in your body, right? It can happen any time. And early detection is the best way to go so that it can be cured, right?
Exactly. You got it.
So, Doctor, thank you so much for coming on Waves of EBC Radio, and it's our privilege and honor to have you and share your knowledge to our listeners, and I'm hoping we can have you again on the radio.
Thank you so much for all of your time, and I appreciate you inviting me here, and again, it's an honor on my part. Thank you again.
Thank you so much.
Take care.